Hi everyone. Malignant melanoma or melanoma, what everybody calls it, is basically a malignancy of the skin. It could affect any part of the skin. It could also affect the mucosa or the lining of the rectum or the intestines or the anal canal, and very rarely it could also affect the retina or the eye also. The main reasons for melanoma is actually exposure to ultraviolet rays or UV rays. So it's not very common in India. It's very common in countries like Australia, New Zealand, and where there is high exposure to UV rays. When it comes to metastatic melanoma, means it has spread to various parts of the body. The symptoms vary based on where the spread has happened. So based on where the melanoma has spread, for example, to the liver, they might have some dysfunction in the liver function test, or if it has gone to the brain, they might have seizures, or they might have some amount of drowsiness, or some amount of weakness on which part of the brain is affected. First, let me tell you, how do we treat a normal melanoma which has not metastasized or not spread to various parts of the body? So usually under such circumstances, we look into local treatment, which is in the form of surgery based on where the melanoma is. And along with surgery, we also look into giving some amount of immunotherapy or chemotherapy. And also for local control, radiation can play a major role. If it has gone to the brain and if the patient is having weakness or seizures, we could also consider giving high dose radiation or radiation to those specific sites in the brain or to the whole brain also. But on an average, whenever we are talking about a metastatic melanoma, the most important form of treatment after the biopsy is actually chemoimmunotherapy. They combine the chemotherapy with immunotherapy after doing some specific markers on these melanoma cells or gene markers or genetic markers or mutational changes which has occurred, and based on that we can customize. We can see which patients are eligible to what type of immunotherapy along with chemotherapy.